Imagine thinking you are using cannabis, but in reality you're not, and you end up in the emergency room with seizures, psychosis, or kidney failure. Welcome to Part 2C, the final part of my cannabis series. Today I'm talking about synthetic cannabinoids, what they are, and why they are far more dangerous than THC. My goal in this video is simple: to help you be more informed, make safer choices, and protect yourself and the people you care about. I'll finish this series with a few questions that are really worth asking yourself. If you haven't seen the earlier videos on cannabis, I recommend starting from the beginning, where you can learn about how the brain's natural cannabinoid system works and the differences between THC, CBD, and other compounds. One thing before we go further. Even natural cannabis has changed dramatically. THC levels used to be around 2-3%. Today, some products reach 80-90%. Synthetic cannabinoids are chemicals made in labs. They are not derived from the cannabis plant. They are called cannabinoids because they are designed to act on the same receptors in the brain, CB1 and CB2, that natural cannabinoids from cannabis plant act on. But chemically, they are very different. They can cause serious medical emergencies, even in young, otherwise healthy people. They are often sold as spice, K2, or legal weed, sometimes even disguised as CBD vapes. Legal doesn't mean safe. It often just means the law hasn't caught up yet. These chemicals are designed to bind to the same brain receptors as THC, but synthetics are much more powerful and unpredictable. Manufacturers typically spray these chemicals onto dried plant material so they can be smoked, or they dissolve them into liquids for vaping. Public health agencies worldwide are clear on this point. There is no approved medical use, no safe dosage, and no reliable way to reduce harm with synthetic cannabinoids. Because potency varies widely and products are unevenly mixed, there is no reliable way to know what dose you are actually getting. There is no quality control. These products are unregulated, illicit, and often falsely marketed as legal or safer. I really want to be clear on this point. They are not safer. They are far more risky. I would like to point out that street synthetic cannabinoids are not the same as prescription cannabinoid medications like Nabilon. Medical cannabinoids are well studied, regulated, and standardized. When doctors prescribe them, we know exactly what is in them and what the dose is. Street synthetics, on the other hand, are the complete opposite. In the last few years, manufacturers have shifted to newer generations of synthetic cannabinoids that are much more dangerous, and this is where the real harms begin. These drugs fully activate the brain CB1 receptors, while THC only partially activates them. That's why a slight difference in dose can suddenly turn into a medical emergency. Psychosis is far more likely. People can completely lose touch with reality, even if they have never had any mental health problems before. Synthetics don't just bind to the brain cannabinoid receptors, they also affect other brain and body receptors. That's the reason we see seizures, extreme blood pressure spikes, strokes, kidney injuries. The recipe keeps changing to stay ahead of the law. European and UN agencies have documented hundreds of new compounds in just a few years. The reality is that the same brand today might contain totally different chemicals next month. Even experienced users cannot predict the effects. Products often contain hot spots, which means one puff might deliver a small dose and the next puff can deliver a massive overdose. Natural cannabis contains compounds like CBD that may soften effects, but synthetics usually don't. Some products are contaminated with other dangerous drugs, including synthetic opioids. That dramatically increases the overdose risk. Standard urine drug screens often miss synthetics. As a result, emergency care can have difficulty to diagnose patients who attend for care. Lastly, these newer compounds are now directly linked to fatal poisoning in North America. There is very strong and consistent data from emergency departments, ICU admissions, poison control centers, and medical examiner reports. In other words, this isn't theoretical. This is what doctors are actually seeing. What do clinicians see most often? 1. Severe psychiatric effects like extreme anxiety, agitation, and paranoia. Hallucinations and psychosis that can last days or weeks, even in people with no prior mental illnesses. 2. Neurological injuries like seizures, loss of consciousness, and coma. Strokes in young people with no vascular risk factors. 3. Effects on heart and blood pressure, such as very fast heart rate, dangerous blood pressure spikes, abnormal heart rhythms, and even heart attacks, even in teenagers. The truth is, many users don't intend to use something with such dangerous consequences. Most of them think they are using cannabis. They look for something cheap, accessible, or hard to detect. But the reality, as I've just highlighted, is very different. When I ask my patients why they use cannabis, I usually hear 3 answers. First, I use it to relax or cope with anxiety, to wind down. When I hear this reason, I know that they are using it to function in the presence of an underlying mental health issue that isn't properly treated. What's important to know is this: cannabis doesn't treat anxiety. In the long term, it usually makes anxiety worse and increases dependence on using. If your goal is to learn how to manage anxiety or tolerate overwhelming situations, relying on cannabis or alcohol actually prevents you from developing real coping skills and resilience. The second answer I usually hear is that, well, I use it to sleep better. This strategy may help in the short term, but over time, the fact is that the sleep quality declines, the sleep becomes shorter, and dependence develops. The third answer I hear sometimes is that I just enjoy it. I want to have fun. That's an honest answer, but let's think about it for a moment. If you use cannabis daily, at some point, you may not enjoy anything unless you use this. Let's expand on some more questions worth you ask yourself. Why do I use it? What does it do for me in this moment? What am I trying to cope with? Stress, anxiety, boredom, loneliness, something else? Is there something healthier I could replace it with? How long do I realistically see myself using it? 1 year? 5 years? Forever? And if I'm a teenager, how do I imagine my future, my career, my relationships if I'm dependent on this? These questions are not to judge yourself, but to understand yourself better. Sometimes just becoming aware is the hardest part, and support can make that process much easier. Talk to a clinician. There are evidence-based, safer options, and whatever your relationship with substances is right now, it's never too late to change it. The bottom line, as I have pointed out in this video, I do not recommend using synthetic cannabinoids at all. The risks massively outweigh any possible benefit. Understanding how substances work gives us more than knowledge. It gives us the chance to change direction, to take better care of ourselves, and to build a future that feels easier, not harder. In my next videos, I will start addressing ADHD and mental health related conditions like anxiety, bipolar disorder, borderline personality, autism, and etc. Thank you for watching.